Have you ever thought if you could be living with high cholesterol without even knowing it? What are the subtle or not so subtle symptoms to watch out for? And when it comes to treatment, what are the options and what risks might be lurking along the way? The term silent disease refers to high cholesterol because it does not typically manifest itself through any outward signs or symptoms. Because of this, it is difficult to determine whether or not you have it if you have not had your cholesterol levels tested. However, for certain people, elevated cholesterol might manifest itself in more subtle ways, include fatty deposits. Deposits of cholesterol can sometimes develop lumps or bumps under the skin, most frequently on the eyelids, tendons, and skin creases. The medical term for this ailment is xanthoma. Pain and stiffness. Cholesterol deposits in the arteries can also cause pain, discomfort, or stiffness in the legs following physical activity such as walking or exercising. This is because there is a decrease in the blood flow. Chest pain. The accumulation of cholesterol in the arteries that carry blood to the heart can cause chest pain or discomfort, medically referred to as angina. Tiredness. Feelings of fatigue and tiredness can be brought on by an increase in cholesterol levels in the arteries, which in turn can reduce the amount of blood that flows through the body. A decrease in the amount of oxygen that reaches tissues and organs can cause shortness of breath, fainting, or dizziness. Cholesterol buildup can cause problems with blood flow, which can lead to these symptoms. On the other hand, it is essential to keep in mind that in many instances, there are no symptoms at all. As a result of this, it is strongly suggested that all adults over the age of 20 get their cholesterol levels examined on a regular basis as part of their preventative healthcare screenings. Detecting high cholesterol levels early can help lessen the risks of cardiovascular disease that are linked with having them for an extended period of time. Treatment of high cholesterol. In the event that screening tests reveal elevated levels of both bad LDL cholesterol and total cholesterol, potential treatment options include modifications to one's lifestyle include consuming a diet low in saturated and trans fats, engaging in regular physical activity, working toward and sustaining a healthy body weight, effectively managing one's stress, and giving up smoking. Statins are a class of drugs that can lower levels of LDL by preventing the liver from producing cholesterol. They do this by blocking enzymes in the liver. Fibrates, niacin, inhibitors of cholesterol absorption, and PCSK9 inhibitors are some examples of additional medication classes. When taken as a dietary supplement, plant sterols and stanols have the ability to inhibit the absorption of cholesterol in the intestines. These substances are naturally present in some plants. Red yeast rice is a dietary supplement that contains chemicals that are similar to statins that are available by prescription and may decrease cholesterol. CBD. There is some evidence that CBD may have favorable effects on the levels of lipids in the blood, especially triglycerides and LDL cholesterol. Nevertheless, we still require additional data. Probiotics. Some research indicates that taking specific probiotic supplements may result in a slight reduction in both total cholesterol and LDL cholesterol levels. Alterations to one's way of life should always come first, even before considering the use of medicine for the vast majority of patients. Beyond cholesterol levels alone, there are a variety of other factors that can play a role in determining a person's overall risk of developing cardiovascular disease or having a stroke, and doctors may base their recommendations for therapy on this total risk. The objective is to get LDL levels down to a level that is low enough to significantly cut the risk of problems. Continuous monitoring makes it possible to make modifications to the treatment as required. Factors that increase the danger of high cholesterol. There are several risk factors that we have no control over that increase the possibility of acquiring high cholesterol, include age and gender. Levels tend to rise naturally with age in both men and women, but levels are typically greater in males. Age is a more significant factor in males than in females. History in the family. Because genetics play a part, having a close relative who has high cholesterol increases the likelihood that you will also have this condition. Conditions affecting one's health such as diabetes, hypothyroidism, chronic kidney disease, and even certain hereditary abnormalities are able to have an effect on one's cholesterol levels. Other modifiable risk factors connected to lifestyle and environment that can contribute to elevated levels of cholesterol include the following. Diet. An increased risk is associated with a diet that is high in saturated and trans fats, such as one that is high in red meat, full-fat dairy products, and fried and processed meals. The health risks associated with obesity include an increase in triglyceride levels and a reduction in HDL values. Physical inactivity. The failure to participate in regular physical activity leads to increased body fat and a lower HDL cholesterol level. Alcohol. Triglyceride levels tend to rise when there is excessive drinking of alcohol. Smoking. The levels of protective HDL cholesterol drop when a person smokes cigarettes. Psychological strain. Researchers have found a link between prolonged psychological strain and changes in cholesterol profile. Sleep deprivation. A lack of quality sleep may have an effect on metabolism and raise the risk of sickness associated with cholesterol imbalance. Managing modifiable lifestyle factors such as nutrition, exercise, and weight in addition to managing stress can give effective defenses against acquiring high cholesterol or reducing levels if they already exist. This is true even though some risks are beyond our control. A multifaceted strategy, when combined with diagnostic testing and, if necessary, medical treatment, has the potential to considerably reduce the risks of cardiovascular disease. Risk associated with high cholesterol. High cholesterol by itself does not directly cause harm, but uncontrolled high cholesterol over a long period of time significantly increases the risk for severe health problems by allowing fatty deposits to build up in the arteries. This atherosclerosis causes vessels to become more constricted, which in turn limits the amount of blood that can reach tissues and organs. Here are some of the conditions for which high cholesterol increases the risk. A heart attack occurs when a blockage in a coronary artery that supplies the heart ruptures, preventing blood from flowing to the heart and causing damage to the heart muscle tissue. A stroke is defined as the formation of a clot in the brain that either blocks or ruptures a blood vessel, causing dysfunction in the portions of the brain that are affected. A development of fatty deposits in the coronary arteries over the course of years might eventually result in ischemia or blockages. This condition is known as coronary artery disease. Pain and discomfort are symptoms of peripheral artery disease, which is characterized by insufficient blood flow in the legs and arms as a result of constricted arteries in the legs or pelvis. Aortic aneurysm is a swelling or bulge in the major vessel that carries blood away from the heart, and it has the potential to burst. Evidence suggests a relationship between high cholesterol levels in middle age and roughly twice the chance of cognitive deterioration in older age, which is a symptom of dementia. Immediate therapy that is directed by a medical expert can significantly lower the risks that are posed by high cholesterol for these disorders that can drastically affect one's life. Even slight reductions of LDL through lifestyle or medicine translate to dramatically lower odds of heart attacks, strokes, and circulation difficulties in the future. Contrary to popular belief, even modest reductions of LDL are associated with considerable risk reductions. Continuous monitoring, together with therapeutic modifications made as necessary, can assist in the upkeep of appropriate cholesterol levels. Excessive cholesterol does not create symptoms on its own, but, if not treated, leads to a greatly increased risk of serious cardiovascular events over the long run. It is essential to detect the problem early on through routine screening and to take preventative measures in order to reduce the risk of disability and potentially save lives. A physician can evaluate an individual's unique health profile and risk factors and then suggest treatment alternatives that are specifically geared toward lowering cholesterol and protecting the heart's health. What do you think of our video? Let me know in the comment section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button before you go. Thanks for watching.